the important part is to think about the chronicity of the problem that is beginning in childhood, and then if the patient has no other complications, the things that happen much later in life. And because that's where treatment is really important for the very early stages of disease. The common thing in children is to have really bad otitis media. That's common in children, so it often goes neglected to begin with, but it so often leads to large perforations in the tympanic membrane, and then ultimately to loss of hearing or deafness. The second complication that I think is really important to understand is the progressive pulmonary complications. The patients get over and over again what you might think is a common viral or perhaps bacterial respiratory infection, but over a period of years, they gradually progress to have chronic bronchitis and even bronchiectasis. So that respiratory insufficiency is common, and the early manifestation may just be getting out of breath or a little asthma. But over time, many patients lose respiratory function. And then the other problem is the viral infections. We see the warts commonly on the hands and feet, but it's the papillomavirus infection, particularly of the vaginal area and the cervix in women, that leads to carcinoma. And that's a very feared complication because, as Dr. Badolato said, this only real treatment is surgery, and it's, in the cases I know about, not very effective.